When I ask patients to tell me their story, many weave a story as if stress were directly related to the development of their cancer. Personally, and I'll talk about this a little later, I don't believe that stress in and of itself causes cancer, but stress is certainly not good for people with cancer or even people without cancer. Because what is stress? Stress is epinephrine or adrenaline, which kills your lymphocytes, and stress is cortisol, which is a steroid hormone, which is an immune suppressant. So decreasing stress is very important, and that is one of the focuses of my involvement with the patient. And I think with all of those things together, we can serve to increase hope. Many patients leave at the end of an hour and say, Dr. Abrams, you're the first person that's given me any hope. And it's not like I've said you don't really have cancer or you're not going to die, but I've empowered the patient by giving them a menu of things that they themselves can do to increase their sense of control. And here are those things. Number one, weight. And we'll talk about this more later, but obesity probably related to about 20% of the malignancies that women develop and 14% in men. So weight control is important. Altering the diet is obviously one way to reduce rate, but many of the people I see, although not that many, consume the so-called standard American diet, abbreviated SAD for good reason. And having people move to a more organic, plant-based, antioxidant-rich, anti-inflammatory whole foods diet is certainly one of the goals of my interaction. Increasing physical activity not only is also helpful for weight control, but it decreases stress and also has been shown for a number of malignancies to impact outcome and survival, particularly breast cancer and colon cancer. Supplements are something that, again, we'll talk more about, but discussing appropriate use of supplements gives the patient, again, another way to increase their own sense of involvement and maybe even control. With regards to stress, I think becoming aware of the breath is the key to mind-body interventions. Before I mentioned breathing, everybody was breathing autonomically. You weren't thinking about the rate of your inspirations or the depth of your inspiration and expiration, but you certainly can, because breathing is something that we can control as well as having happen autonomically. And that's the link between the mind and the body that's used in yoga, meditation, hypnosis, all of those things. So just teaching people a little bit about breathing is one way that we can learn to decrease stress. Further on, there is guided imagery, biofeedback, self-hypnosis. Connecting with family and friends. I've mentioned that I rarely see a patient coming to see me alone at the Osher Center. So obviously people have people that love them and people that support them, and it's worth tapping into that in this time of crisis. I asked before I end my interview if the patient was raised with any religious beliefs. Pretty much everybody was, but many people have lapsed. Then I ask if they consider themselves spiritual, and most people do. I finally conclude by asking 3 questions. What brings you joy? What are your hopes? And where does your strength come from? And patients are sometimes challenged and startled by those questions. Often one of those 3 questions will bring tears to the patient, which is informative as to which one that is. But at the end of my session, I remind the patient that they still have joy, hopes, and strength, regardless of their diagnosis and their stage of disease. And that's something important to return to the patient at that time.